And welcome to the Associate Physician Program training video. I'm David Harrison, Associate Medical Director for the U.S. Group Health Division of Best Doctors, and also an internal medicine pediatrics primary care physician at Massachusetts General Hospital. You have been selected for the Associate Physician Program because of your truly exceptional performance to date supporting our interconsultations. The Associate Physician Program is really a lot of fun because you get to do all of the learning that you've known up to now, composing the clinical summaries, but you also get to play a much larger role in Best Doctors operations, and most importantly, provide even more support to the members who put their trust in us. And that trust is probably the most important part of this entire video. Members are trusting us. When someone has a difficult, often frightening medical problem that they're faced with, and they come to Best Doctors, we can do a passable job or we can do an amazing job. And for them, they may not necessarily know the difference. Because of that, it's incumbent upon us for every single case to make sure that the clinical quality of what we produce is at the very highest levels possible. So, in this video, we'll basically go through all the various tasks that an associate physician needs to do. We won't cover composition of the clinical summary because you know that very, very well already. But there are two other tasks that are very important to go through. One is scoring and analytics, and two, for select cases, is report delivery. First, the scoring and analytics. When Best Doctors first started, we just would write clinical summaries as MDCs, and there was no oversight. It was kind of like the Wild West. And back when I was an MDC in 2005, I could write a great clinical summary, I could write a mediocre clinical summary, and there wasn't necessarily a whole lot of feedback or oversight. But it was recognized that these interconsultations are very, very complex. There are many places where things can mess up, and there's also many opportunities to really go above and beyond and do a truly outstanding job for the member. Because of this, the lead physician role was created, and the lead physicians would be basically provide the physician leadership for every single case. And there was this division of labor. The MDCs would write the clinical summary, and the lead MDs would provide guidance, support, and also perform scoring and analytics. However, when the associate physician program started, we recognized that exceptional physicians who are writing clinical summaries could also bring tremendous value in performing these scoring and analytics. And after they know the cases so well, they could also really help the member by performing report deliveries on the phone for particularly complex cases. So the associate physician program was born. And the associate physician is an amalgam of the MDC and the lead physician roles, writing the clinical summary, performing the scoring and analytics, and also performing report delivery. Within this program, we also have the lead associate physicians who provide invaluable quality oversight, mentoring, feedback, and support. And throughout your time with Best Doctors, they always will be people you can turn to whenever things get a little bit hairy, as they often do around here. So to dive into the nitty-gritty of the tasks, when a clinical summary is completed, it goes to the expert, and then you'll get the notification that the report is in, and you'll need to go and perform scoring for the report and scoring of key tasks within the interconsultation, and most importantly, approve, reject, or request an addendum for the report. To make these scoring and analytic tasks easier for you, we've created a unified physician workspace where you can do all of the scoring and analytic tasks using one online survey tool. So when the expert report comes in, you'll also log in to this tool on Zarka Interactive and be able to fill out these different components of the scoring and analytics as you read the report, or if it's easier for you, once you've completed reading the report. Most importantly, you have to decide if the report is accepted, rejected, or if we need an addendum, we need more information. It's very important because if a report goes out with inaccuracies or where the members' questions have not been adequately addressed, or where there just is not very um, robust or meaningful clinical information. If any of that happens, we haven't really done our best to do right by members. If you reject the report, please also let the lead associate physician and me know. If there's ever any questions, obviously all of us are resources for you as well. In addition to accepting or rejecting a report, there are a number of key tasks performed within Best Doctors operations where you provide the quality ratings. These are very, very important because these basically tell us how good a job our case coordinators, MAs, PSDMAs are doing at getting everything together the way you need it to create the best clinical summary and for the expert to create the best report. Within your training manual, there are very clear criteria that explain all of the ratings, and I really do encourage you to look over those and make sure that that you're comfortable with the different criteria that define the ratings. So you'll define service line assignment. Was an interconsultation the right kind of service for this member? Was it right to be an IC light or IC inbound? Was an FBD, would an FBD better have served the member, or an ask the expert? We also look at medical records collection. If, when you received the notification to review the case, there were important records missing, that's important to note, to reflect in your rating of medical records collection. Expert case matching. How well did the expert match the case? And that's not only was it a cardiologist for a cardiology case, but did the expert have the appropriate degree of clinical and/or research training to really provide an authoritative response? And also clinical integration. Our members come to us and they have many health benefits available to them. Things like smoking cessation and disease management and nutrition counseling. And if we can help plug them into their other benefits, we can increase the impact of the services we provide. After you go and rate our internal operations, it's important then to look at the Best Doctors report itself. You'll go and score the Best Doctors report, and again, criteria for that scoring are listed in the Associate Physician Training Manual. You also will assign diagnostic and therapeutic impact ratings. Basically, that is a number from 1 to 4, 1 being no impact, 1 minor, 2 moderate, 3 major, basically saying how much potential does this expert report have to change care. Maybe the expert doesn't know exactly what the diagnosis is, but if some really key studies are recommended, that is a case that has a high diagnostic impact. If someone's planning surgery and the expert recommends against surgery at the current time, obviously that's a case that has very significant therapeutic impact. You'll assign those ratings. And once you've assigned those ratings, then it's time to really get into the analytic portion of the case. Let's take that 7th inning stretch. Follow me. Never a bad time to get some more exercise at Best Doctors. Much better. Let's get back to work. So case analytics. Before we started performing our analytics of diagnostic and therapeutic on the diagnostic and therapeutic worksheets, all we had to convey our impact were stats like we changed the diagnosis 29% of the time, we changed treatment 60% of the time. But if someone asked us, well, what do you mean by change? We would say, well, we mean change. We're not really sure, but let us tell you a good story about a cool case we just did. And that really isn't adequate to convey the kind of impact that we're having at Best Doctors. So the diagnostic impact worksheet goes through and assigns a category of confirming the diagnosis, changing it, adding diagnoses to the differential, reassessing the severity of an established diagnosis. And once that category is assigned, there are a number of different diagnostic impact elements? Did we change the pathology read? Did we recommend additional lab studies? Did we integrate elements of the history and the physical exam in new ways to lead to conclusions that had not been considered up until now? You'll go through and just check off in the checkboxes all of the elements that contribute to this diagnostic impact. Not only is this going to be used for us conveying our how we change impact externally, but it's also used for our own internal research purposes. Actually, we've even entered into relationships with academic researchers who are very excited about looking at what we do in providing virtual second medical opinions and are researching how we help to enhance diagnostic accuracy. Additionally, there are efforts that Best Doctors has worked to initiate to create a statewide Massachusetts task force on diagnostic accuracy. And the information that we're collecting on diagnostic impact may very well end up informing this statewide task force and the public policy that it will end up legislating. The therapeutic impact worksheet is very similar. Yes, we might have changed the therapy, but did we recommend against surgery, recommend for surgery, recommend a different surgery, different medications, recommend starting physical therapy, acupuncture? All those different elements that we bring to bear on a member's treatment plan can just be checked off. And finally, there's the pre and post diagnosis, diagnostic evaluation, and treatment itemization worksheet. And that's really a tool that's going to be used by our outcomes team that performs financial analyses on our cases. We need to be able to show our clients, hey, you contracted with us, but look at all the ways that we've helped to improve the health of your members, and because of that, help to save you money. And our outcomes team needs the information provided to help compare what the plan was before the member came to Best Doctors with what the plan was after. The pre and post diagnoses are pretty straightforward. Under secondary diagnoses, you can also list items that are on the differential diagnosis. With the pre and post diagnostics, major diagnostic studies, you do not need to list every diagnostic study the member has had. The important thing to list is what the major diagnostic studies are that are currently being proposed. Is the treating physician saying the member should have a cath or should have a biopsy? That would be a major pre-Best Doctors diagnostic recommendation. And then what the expert recommends would be the post-Best Doctors recommendation. And if the recommendations are the same, you'd put the same thing in each column. And treatment recommendations, same thing. No need to write every single treatment the member has had, just the major treatment or treatments that are currently on the table before the interconsultation, and then the major treatment considerations that the expert recommends. That's it in terms of the analytics. Finally, a really important document that the associate physician produces is the BDRS, the Best Doctors Report Summary. In this, it's almost like a Cliff Notes for the member. It distills the often pretty complex technical information in the expert report into a few short paragraphs that really capture the key take-home points of the Best Doctors Report in plain language. The most important thing to remember about this, besides avoiding excessive jargon, is trying not to be too directive in the language you use. Sometimes the experts might say, oh my gosh, this patient really needs to have surgery now. But when writing the Best Doctors Report, better to say, Dr. Smith recommends that you and your treating physician consider surgery as a next step. I'm really glad, Mrs. Jackson, that this has been such a good experience for you. And if there's anything else that you need from Best Doctors, don't hesitate to let us know. I just finished a report delivery, and boy, was it satisfying. In all seriousness, report deliveries can be a lot of fun. Members are often very, very grateful for what we do. When starting the call with a member, it's important to make very clear to them that all we're providing is information, and that no changes to treatment should be implemented without first discussing them with their treating physician. The report delivery call itself has two main objectives. One, is to make sure that the members' questions are answered and that they feel comfortable moving forward, having discussions with their treating physicians and helping to implement the best doctor's recommendations that they hope to implement. And number two is really underscoring the main take-home points for the member. There's a lot of information, but it's important that they know what the 2 or 3 key take-home points are. When you have the report discussion, there will be times where they'll ask questions where you may not know the answer right away. And there's going to be 3 main options when that comes up. First, you can go back to the expert for an addendum. Of course, that's going to take time and back and forth and all that. Another option is that you can tell them, wow, that's a really great question, and I think it's a perfect one to ask your treating physician. And you can help them frame the question in language that's clear and concise. That way, you may not be answering the question yourself, but you'll at least be empowering them so that they can bring the question to their treating physicians. And then finally, if there are a lot of questions that are coming up, and especially if they feel like they don't necessarily want to continue care with their treating physician, or if they need to see a new subspecialist, a new specialist, another option to them is getting a Find Best Doctor consultation, where we can go and identify local specialists from our physician network who can help support them. And most of our clients have FBD as a service. The one notable exception is Boeing, but that's not something you have to worry about too much. Once you're done with the report discussion, it's important just to do a little bit of documentation. First, you're going to document in internal notes what the main content was that you discussed. In this documentation, it's very, very important to note whether the member is considering, how the member received the report, if the member is planning to discuss the report with treating physicians, and if the member is planning on implementing recommendations. This is so critical to our outcomes team that does the financial analysis. Of course, if the member says don't have surgery, and the member says, well, thank you very much for saying that, but I don't care, I'm going to have surgery, we're not going to claim cost avoidance. So it's very critical for us to understand how the member has received it. Also, recognizing that we need to show how valuable the services have been that we've provided. If the member has any positive quotes, wow, Best Doctors is the most amazing thing I've ever had, then it's great to document those quotes as well. There are some empowerment questions within the CRM platform that are important to fill out. When you're done with the call, you'll document it. Doesn't require a lot of documentation, but the main things to note. First, just the content of what you discussed. 2, very important to document how the member received the report. Finally, once you've finished the report discussion call, you'll just quickly document it in CRM. It doesn't require a lot of documentation, but there are 3 main components. Number 1, just document the content of what you discussed. Number 2, document how the member received the report. Were they very positive, or were they a little bit less happy with it? And 3, if they plan on discussing the report with their treating physician and hope to implement the recommendations. This is so important to our outcomes team because we don't want to claim any financial impact if the member is not planning on implementing recommendations or discussing the reports with their treating physician. Also, when you're documenting how they've received the report, if there's positive feedback, glowing comments, please note that positive feedback, because that again will be very valuable to our outcomes team and to our account managers when they're conveying the value of our services to the members. Once you've finished all that, you're done. And that's an interconsultation. Thank you if you're still awake for your attention. And if you're not awake, what's great is this is recorded and you can just put it on loop and dream about it, which will be even more exciting. Well, let's take a break and meet Dr. Lou Levy. Come on, follow me. Just right this way. Hi, Lou.
Hey, Dave. Welcome. How can I help you?
Well, we're just filming this training video for the associate physicians and would love for them to get to hear a welcome message from you.
Hi, I'm Lou Levy. I'm the Vice President of Corporate Medical Quality at Best Doctors, and I just wanted to thank everybody for all of the work that you've done for Best Doctors already. Just last evening, I was reviewing a report of a woman who had come to us with a cyst that was felt to be pre-malignant, and she was facing a hysterectomy. And as in many of these Best Doctors cases, pathology was reviewed. It turned out to be a simple cyst. She didn't need a hysterectomy. Very dramatic for the member. She was absolutely delighted with the results of this evaluation and the fact that this surgery, which she obviously was not looking forward to, was totally unnecessary. These kinds of stories are so common at Best Doctors, and it's really only because of the work that everybody is doing to kind of make these kinds of stories happen. So I just really want to thank everyone for all the work you've done already, and I think you're really going to enjoy the AP role. You're in good hands, and certainly if there's anything I can do to make your lives any easier, feel free to give a call. Thanks so much.
And that's it. That's the interconsultation from the associate physician perspective. Thank you once again for your participation in the associate physician program. Really, all of us are very, very glad to have you involved and always want to be supports to you. The nurses, the case coordinators, the lead associate physicians, and myself and Lou Levy are always here to support you if there's ever anything you need.